Sherlock, and I think there's no doubt, Minister, that the communities which have been ravaged by crime and addiction have been clamouring for a number of the measures that are in this bill to be implemented out of desperation for the blight that has been imposed on their communities, to see the most vulnerable people exploited by those who want to profit from their misery. But I suppose, while stating that and appreciating that, I do think the support for these measures does come from a desperation, and we do have to stand back. I understand people saying, well, look, we need to bring this in now, and then we can look at the bigger picture and change and tack on policies later. But I think we can't put off that debate. We actually have to change our approach now. The very fact that we're even looking at a bill which lengthens a list of medication to add to another list of medication that's already prohibited is an indication that that type of approach just sadly doesn't work. Because the reality is that people with addictions are going to find other drugs. And if we add on to the list, then in a couple of weeks' time, there'll be another list and some other concoction within their reach after that. They'll find other ways to get highs. They'll find whatever means are available. And in actual fact, in many ways, you could argue that drawing and lengthening the list increases the risks associated with drug abuse. I think all of us would agree that drugs destroy lives. It's unquestionable. Drugs destroy communities, but so does bad policy. So does unemployment. So does cutting funding to schools, closing down creches, libraries, swimming pools, and so on. And we have to look at the big picture. And sadly, criminalising people and demonising working class communities doesn't work either. And it is the fact that these measures are going to be implemented in working class communities. There's no question about that, because economic and social problems are a factor. I mean, this morning we had the privilege, a couple of us, of going to Clover Hill prison, where we met some offenders who were involved in a really innovative and actually internationally award-winning programme with the International Red Cross about dealing with a community-based healthcare model of prisoners, delivering it in the prison community, working in close conjunction with the medical staff and indeed the prison staff in that facility. And I think it's something that we should certainly try and get them to come in here and give a talk to the Oireachtas, because all of the people ended up in there through one way or another through drug-related crimes, be it some tragedy or something that happened in their lives that led them back to a path of drug abuse, maybe that then involving criminal behaviour such as theft and so on, their incarceration then impacting on their spouses and their partners, who again engaged in sort of crime as well to deal with the economic issues. And we have to take in all of these factors when we look at drugs. Our whole prison population will be entirely different if the drug issue was dealt with. We would have a fraction of the size of the prisons that are there. And I think in that sense, the starting point for me has to be a health issue rather than a criminal justice issue. That is the widespread consensus across the medical profession, and those specialise in addiction will tell you it's a disease. And we have to look at dealing with the stigma, reducing the harm and tackling it as an illness. We cannot arrest ourselves out of the problem. And that's really what we're doing. And particularly when you're putting people into prison, in an Irish context, you are putting them into the path of further drug use. Sadly, it is the case that drugs are rife in the prison community. We know of cases where people are even encouraged by dealers on the outside or by debts that they've been tied into, to, when they're trying to rebuild their lives, get released out, to break the conditions of that release, to go back in, loaded up with drugs inside them, to feed that. So people who had a chance, who wanted to move on with their life, are even being dragged back into that cycle because we continue to deal with it in a criminal way, and we don't give people the opportunities to develop their full potential as citizens. And the lads we met today, who are working very closely with the staff in the prison, who do a really good job, are people who acknowledged that they had done wrong in their lives. None of them were begrudging the fact that they were in prison, but all of them had got to a place where they saw it as an opportunity for them to rebuild their lives, re-engage with the community and with society. And that's really what we should be doing. We have to treat people as people, give people respect, understand their humanity and their dignity. And that's to me, a far better way. So to me, in some ways, looking at this, you could say, well, sure, look, it's only an immediate thing and we'll deal with the bigger picture afterwards. But I just don't think that is good enough. Really, what we're doing with these regulations in many ways just takes the war on drugs onto a local level of criminalising the most marginalised, and it won't, sadly, have any impact on the big players who live the affluent lifestyle and prey off the vulnerable. And I think any people who work with people in addiction and family members and so on would agree that the answer is not punishment but rather treatment. And to me, the Department of Health should be leading a progressive approach in this way. Education, supporting programmes to combat addiction and the take-up of drugs by young people. I think, sadly, the measures in the bill probably are, because they're one-sided, is a repeat of bad policy. It means drug barons getting richer and the poor getting prison. And I again want to, I suppose, laud the Portuguese model, which we've talked about a lot over the past period, where Portugal took the steps 14 years ago to treat possession and use of small quantities of drugs as a public health issue and not a criminal one. Now, in Portugal, if you get caught with a small amount of drugs, you don't end up in jail, you don't end up with a criminal record. If you are found in possession of less than a 10-day supply of anything, be it marijuana to heroin or whatever, you're sent to a 3-person commission for the dissuasion of drug addiction, typically made up of a lawyer, a doctor and a social worker. The commission recommends treatment or a fine, otherwise the person is sent off without a penalty. And the facts have proven this approach. In 1999, nearly 1% of the population of Portugal was addicted to heroin, and drug-related AIDS deaths were the highest in Europe. They decided to decriminalise in 2001, complemented this policy with allocating resources to improve prevention, treatment, harm reduction and socially integrated programmes. The level of drug abuse has decreased. It's now below the European average. Drug use amongst young people has declined. Deaths have declined. The number of people in the courts and so on, offenders in prisons, have all reduced. And we know they're not the only country. 25 other countries have removed criminal penalties for personal possession of drugs. And when you combine that with the freeing up of Garda resources, which many of the communities most inflicted will be looking for extra resources, I think it's a far better way of dealing with it, focusing on the health improvements. And prison, sadly, doesn't deal with that, although, as I said, there are some great programmes in our prison system. But if people are in prison and are engaging with these programmes, which are giving them leadership skills and a sense of self-worth that they maybe never got on the outside, but then they go back into the outside, into the same conditions that they were in before, well, then that's going to make those people prey to drug abuse in the future. It's totally human nature and very, very understandable. So I suppose it's one of a number of measures that we're discussing in the House over the next period. I suppose what I just really wanted to say is there is no quick fix issue. But we do have to be careful in implementing measures, that the measures we're trying to do with the best will in the world can sometimes actually end up causing more harm and imposing amongst some of our most vulnerable young people, actually bring them into the criminal justice system when we should be working with them to keep them out of that situation. And I think, you know, it isn't a case of, well, sure, look, we'll deal with this now and then we'll deal with all that good stuff later on. The direct experience of other countries is we have to deal with this as a health issue first and have a serious alternative integrated approach. So thanks, Chair.